Public health organisations face a range of challenges, such as the health of employees, particularly shift workers, and how best to consider investment decisions when funding is tight. Researchers at the York Management School take an applied interdisciplinary approach to addressing these complex issues. Nick Thatcher went to find out how their work is making a difference.
Helen Millard knows all about the realities of shift work. She's a healthcare assistant who's just about to start the first of 3 nights working in a mental health unit. She's preparing meals to take with her so she can have something healthy to eat while she's on duty.
I love my job. I can't imagine doing anything else now. But it can be really, really challenging. It's long days and lots of stress. But I know how important it is to look after myself, because if I don't take care of me, I can't take care of other people. So I try and eat well, get plenty of sleep, get plenty of exercise.
So when health managers decide to change working patterns for their employees, how do they ensure it's in the best interests of both their staff and their service users? Well, that's one of the health-related questions researchers here at the York Management School are working to address.
Okay, so what we have here, we've got some quotes from some of your staff. So this is one of my favourite ones.
Dr. Jane Suter and Dr. Tina Kowalski have been working with one NHS trust to study the impact on staff from changing an 8-hour shift pattern to a 12-hour one.
So what we've done is we've gone in to this trust to map out how this change is impacting on a number of factors, such as staff absence and sickness, quality of patient care, whether there's been an increase in violence from patients, and we can look at the trend and model what might have happened had we not introduced a 12-hour shift pattern, and then we can couple this and complement this from the qualitative interviews and views from the staff about how it's actually impacting on them and how they're adapting and responding to this change, and follow this up over time.
Without the York Management School, we wouldn't have been able to do this. When you look at it from a clinical perspective, you think, okay, this may work. Let's see if it's going to work. What we now need, though, is to look to the research. And then from that, we can then look at what changes we need to make to ensure that we are supporting our staff, meeting the needs of our organisation, and that we've got a healthy workforce.
And by working closely with public health officials and the government, another research project at the York Management School can help put a value on health promotion.
The work of the Management School has been really influential in influencing Treasury Green Book guidance. So in health terms, if we take childhood obesity as an example, it's about making sure that if we invest in prevention now, we place high value on the benefits that gives in the future. And the work of the Management School has been particularly important in terms of long-term discounting, where you're looking 10, 20, 30, 50 years hence, so that the benefits we get from investing now are felt right across a lifetime.
We're talking about, in terms of childhood obesity in particular, we're talking about young children here who are starting their life with really poor health outcomes. So anything that we can do to address that now, so that we're not storing up problems for the future, would be of great benefit.
Prevention is better than cure.
Absolutely.
At the York Management School, we work with many organisations to improve their capabilities. So we work with the NHS on LGBT staff networks. We work on adaptive clinical trials to try and get better results faster. We work with the North Yorkshire Police to help them deal better with incidents involving mental health. And that just shows the breadth and interdisciplinarity of the research that we do in the school and the impact that we generate.
The York Management School prides itself on research with a real-world application that not only shapes public health and other non-commercial organisations, as well as for-profit businesses, but supports the productivity and well-being of their employees.